we really focus on the person as a whole. 75% of our treatment is essentially lifestyle optimization, 20% hormone optimization, the last 5% is supplements, prescription meds where we can't cover that. I'm Mason. I'm one of the nurse practitioners here at Live Oak. I've been a nurse practitioner since 2017. I started in orthopedic surgery for that first year or so, and then I kind of transitioned myself back into the emergency department. I was a nurse originally in the ER and ICU, and so I kind of worked myself back into the ER as a nurse practitioner. After that, I went to urgent care for a couple years, and while I was at urgent care, I kind of started building Live Oak in the background, was recognizing that there is a need. I started as men's health only and recognized that there's just a gap in care where people just didn't really care about guys as much, and testosterone replacement was still kind of taboo, but I saw the benefits that it could provide, so I brought that into the community. And then the GLP-1 started being popular, and so I started utilizing them basically for just the guys and the wives of the guys that were already patients, and I saw that they're very safe and effective, and we kept getting positive results. So eventually I changed the name to Live Oak Testosterone and Weight Loss, as I probably had more females working with GLP-1s than I had guys on testosterone. But while doing that, I also recognized that I was missing a crucial component of women's health, which was hormone optimization. And I would tell these women, like, hey, you need to get your hormones optimized, and I would send them out, and they're met with resistance from their primary care providers or their OBs, that they were still scared of doing hormones. And I wasn't, because I'd already seen the benefits of hormone optimization in guys, and I'd been getting further training the entire time in women. Then Addison came on board as a female, where she was helping with women's health. We also had a dermatology side at that time. We don't have that anymore, but Addison kind of helped get that going. And Tiffany stepped in as Addison was leaving and really took over the women's health portion. With Addison having a dermatology background, we brought in aesthetics to really help people feel confident in their skin, and just so that they feel good on the inside and out about themselves. So we have an aesthetic portion of the clinic. Tiffany came on and was just killing it. Myda also then came on at that later in that time, where we were able to extend the services with women to general well woman exams and provide even further sexual health options with the OShot. In hormone optimizations, libido and sexual health comes up a lot, and so that is something that a lot of places are still scared to talk about, but it needs to be part of both men and women, as it is a part of being a human, and we just want to provide a place where people can talk about it safely and freely and provide them options for it. So we really focus on the person as a whole. We want the lifestyle to encompass the majority of their health. Frequently talk about making sure you get enough sleep, what your nutrition looks like, what does your exercise look like, what does your mental health and stress management look like. We want to provide an entire picture of the person, and then we get advanced lab testing to see, is there a hormonal decline? Is there gaps in, any vitamins, minerals, blood counts, anything off with kidneys, liver, metabolic health? And so we're doing a deeper dive into that. We get body composition scans with everybody that comes in to check their muscle mass, their body fat, and provide further insight to, what their body looks like, combining that with advanced lab testing and providing hormone optimization to fill those gaps. We sell supplements. I try not to be a supplement salesman, but we have them because we are able to identify deficiencies in areas where supplements can help fill the gaps. I like it to be, 75% of our treatment is essentially lifestyle optimization, 20% hormone optimization, the last 5% is supplements, prescription meds where we can't cover that. Colter has been able to come on. He has been the newest member of Live Oak. And Colter provides a cardiology focus, so where we can even expand our lab testing into advanced cardiac panel to provide further insights to longevity. And he also provides the functional and integrative health testing, which is like heavy metals, mold, gut health. That can identify maybe we have everything else optimized well and somebody's still having troublesome symptoms, and that can a lot of times pick up that missing link that was missed through the traditional lab evals and everything. And so it's just providing a different look into the person that's not typically addressed through a normal primary care provider. we try and spend enough time with you to really get to know you as a person, what you're struggling with, and give you the time to express yourself. So we're not just talking to you and then you're walking out the door. You get to provide us feedback so we can see if there's anything on where those gaps can be filled. And then we have kind of that orthopedic background where we have little discussions where we can talk about pain management with low-dose naltrexone or shockwave therapies or PRP. We have further sexual health treatment with P shots. I use vacuum erection devices like a penis pump. It's kind of like exercise for your penis to help with erectile dysfunction. Do the shockwave treatments for erectile dysfunction as well, go in and break plaques. We have the aesthetic side of the clinic to provide overall aesthetic procedures if you're looking into that. So just trying to take care of the person as a whole, encompass everything in terms of health. The latest thing that we've brought on is the VO2 max testing, the RMR testing, the resting metabolic rate testing, and that kind of completes the circle in terms of overall metabolic health and evaluation. It provides us a functional assessment, gives us data on how functional this person is, while throwing out our VO2 max, which is just a sum of oxygen you can exchange through your cardiovascular system, your respiratory system, and it provides a good insight while also giving us in-depth data amongst other things. And so I do feel that we provide a very comprehensive evaluation into the person as a whole and just provide them further insight and treatment options that aren't available through your regular primary care provider. We also brought a registered dietitian in-house to also provide us a better option and time for our weight loss patients, our hormone optimization. As a lot of times we want a better body composition. We want, we talk about weight loss all the time. And it's hard for the clinicians here to hit 30, 45 minutes of nutrition choices alone. So the registered dietitian who has a degree in nutrition, who has board certification in nutrition, who has, clinical hours in nutrition, gives insights and help along and helps kind of oversee everything. So we can have people see her, get that dedicated time, whereas the clinicians are covering meds, side effects, lab reviews, and we are trying to cover everything in a condensed time. We get you to follow up with her to give you that dedicated time to nutrition alone. So we moved into a bigger building last year, which allowed us to kind of improve our throughput and provide more options for people, better bathrooms, so better quality of life, compared to our other one. But, the bigger location has just allowed us to facilitate a better patient load, a better patient experience while you're here. So total, we have over 35 years of experience as a nurse practitioner unit, and our clinical team combined has experience in orthopedics and emergency medicine and urgent care, in family practice, in palliative care, in pulmonology, in cardiology, in women's health and obstetrics. And so we bring solid clinician experience and real patient interactions and time to these hormone evaluation and optimization patients. We're not just throwing meds at people and getting them lost to the wind. Whereas with the normal telemedicine service, you may just click boxes and be sent meds, and there's no instruction, no follow-up. You're not able to really get any type of discussion with your clinician. Whereas we are involved and we text with our patients. If you have side effects, we want to know. If you have questions over anything, we're accessible. And so I think that's another big component of the clinic that I'm proud to say that we can provide for. Our bread and butter and the thing that we are going to be the best at is going to be overall hormone optimization. Hormones are going to provide the person the essentially building blocks of life. You feel better, you have more energy, you're more stress resilient, so you're able to tackle your day easier. You're not as moody, and so people who do have this hormone optimization typically just have more life or vigor. They've kind of taken the park and brake off, and they can function to the best of their ability they know they can. And so that has kind of been the driving factor. The other thing is just making sure that we keep everybody metabolically healthy as best as possible. That does look like weight management, body composition, but also just making sure the engine is tuned and the pipes are clean, trying to keep overall longevity so that the patients are still functioning well into their 80s, 90s, triple digits, and functioning. We're not just getting to these numbers. We're looking at everything: lipids, metabolism, body composition, and trying to make changes and suggestions along the way to keep that engine running as efficiently as possible so they can provide the best outcomes for themselves, their family, their friends around them, their job, and they can function to the best.
I'm Tiffany. I'm a nurse practitioner here at Live Oak. I have been a nurse practitioner for about 12 years this year. I come from a traditional approach in medicine, which can be really helpful in this setting, but it was really fun to make the transition into wellness and focusing on health and longevity. So a big part of what I do here is women's hormone optimization, and we talk about testosterone, progesterone, estrogen, thyroid, all the things that make a woman who she is. And a lot of the times that get lost as we age. Hormones fall off. Women just don't feel as well as they used to. And so, diving into that and what's important to them, helping them find themselves again, whether that be with hormone optimization or even weight loss, maybe both of them together, health, fitness, all of those things, all of those aspects, like I said, that make a woman are my focus here. And we have a lot of fun doing it. Although hormone optimization and weight loss are my primary focus here, I also like to do some aesthetics. My focus is more on neurotoxins and microneedling with PRP, PRF, either way. I like to be Liz's assistant at times too, to help with whatever she might need.
My name is Colter. I'm a nurse practitioner here at Live Oak Testosterone Weight Loss, and I am doing hormone optimization, functional medicine, and advanced cardiometabolic evaluation. The reason why I am crunchy and now believe in more alternative medicine and pursue integrative health is actually because my wife has previously suffered with autoimmune illness, and I saw the journey and the benefits of her working with a functional medicine practitioner, and through that and her faith, she's healed. So that was inspiring to me. I also see the deficit in looking at the whole person in Western medicine, and so I wanted to pursue functional medicine to treat the person as a whole and help them get better. Maybe even whenever their lab testing says that nothing's wrong, but they still feel horrible, that's where I kind of...
Hey, I'm Myda. I am one of the nurse practitioners here at Live Oak. It's been super exciting to be able to join the team. I've been a nurse practitioner since 2017, and so much of my background's been in women's health as a family nurse practitioner. So being able to offer that amazing comprehensive service here at Live Oak has been really good. Part of what I do here, for anybody who's wondering, we do offer comprehensive women's health. So what that looks like, hormones for females. We also do weight loss for women. Included on top of that, a service that I can kind of add to that is your yearly well woman exam. So it is very important that women continue to get that. Even if you've had a hysterectomy, you still need that. We need to make sure we're doing breast exams, pelvic exams, where we're addressing ovaries, uterus, if it's still present, vaginal exams. And so I want to be that good service for you guys so that women have the opportunity to talk about changes their bodies are experiencing. We're doing that preventative care, which is very important for women, and just be able to have those conversations in private. Also, one of the services, including women's service, is going to be sexual health. It is very important that women have a safe place, a confident place to come to and be able to get that addressed. So one of the things that we can offer along with hormone optimization, specifically testosterone therapy, if you're still needing some more support, one of the things we can add is definitely going to be different adjunct medications, whether that's improving libido with medication, arousal. One of the procedures I do offer here is going to also be the OShot. So a lot of people always ask, what is that? Does it hurt? It is a very simple in-office procedure with very little downtime. What we do is utilizing your body's own natural growth factors. We will help support that regenerative care where we can improve sexual health, improve sensitivity, lubrication. It also helps a little bit of urinary support, which is really great for a lot of women that are active. So yes, it's a quick service that we offer. One of the additional female services that I offer is also aesthetics. So in part of that, you can come and receive through myself Botox. We do microneedling sessions, PRP, PRF. Also, chemical peels, stimulator peels. So we do offer a lot of different services with that. Myself and some of the other providers here are great resources for you.
Hi, my name is Liz. I've been a nurse since 2017. My role here is the RN health coach and also the aesthetics nurse. I do a lot of regenerative treatments such as Sculptra, Easy Gel, marketing with PRP, PRF, hair restoration with PRP, PRF, and also Botox, Daxify, neurotoxin treatments. I also specialize in facial profile balancing with dermal fillers and Easy Gel. I feel like aesthetics is very important here at Live Oak because a lot of the focus can be put on helping hormones, weight loss, but what's also important is the way you look on the outside. And I take a lot of pride helping people feel confident in their skin, help them look a little bit younger, and just feel youthful, restored, and vibrant again.
Definitely come see us if you have any questions. We want to be that support for you guys.